As we look forward to celebrating Veterans Day tomorrow, it's a reminder that here at Volunteers of America, every day is truly Veterans Day, because it's not just about a simple thank you, it's about meeting every need, being holistic, whether it's from underwear to a suit. And you show that, and you and your staff show that each and every day. So now we're going to turn to some responses. First up is going to be Vince Giardina from the Oscar J. Tolmas Charitable Trust. And as you heard, they have been extraordinarily generous in supporting the mission of Volunteers of America Veterans Services. So I want to preserve as much time for questions. So without further ado, I'm going to turn it over to Vince Giardina.
Thank you very much, Nick. First of all, I'm not sure that everyone on this call knows of the Oscar J. Tolmas Charitable Trust, so I'm going to give you just a short little resume of it. Mr. Tolmas was my client. I'm a CPA, and I was in public practice, and he was one of my tax clients. He left 100% of his assets upon his death in December of 2013 to the Oscar J. Tolmas Charitable Trust. As Gerald, or as we call him, the chief, mentioned, Oscar was a World War II veteran, and he was honorably discharged in 1946. Oscar was also a lawyer. He was a member of the bar for 70 years until his death. He didn't really practice a whole lot, but I think his undergraduate degree at Tulane and his law school degree at Tulane helped him out in his business endeavors. He was a home builder and a developer of real estate. He was also a wise investor and a shrewd businessman. And as I said, he left 100% of his assets to this trust that bears his name. I'm the president and trustee. And so far in 2020, we have made donations to over 60 organizations, primarily benefiting Jewish causes, children's causes, veterans causes, and community projects. I guess everyone knows why now we support Volunteers of America Veterans Program. It's because of the dedication of the employees of the Volunteers of America, primarily Gerald Rooks. In 2015, and I just looked it up, Jim, in 2015, that was the first year that we started to give away money. And Oscar being a World War II veteran, my co-trustee Lisa Romano and I decided we wanted to support veterans' causes. Not so much just to house veterans. We wanted to help veterans. We wanted to transition veterans. And those two buildings that bear Oscar's name are transitional housing buildings. We just felt that we had to do that in his name to help those veterans. And due to the dedication of Gerald Rooks and Volunteers of America, we decided to use Volunteers of America as one of those charities that we could support veterans services. And when I first met Jim and we walked through Pitt Street, and it was a mess. It was just a mess. And when we walked out, Jim said, well, Vince, we need some money to close this gap. And I immediately went back to our office, spoke to my co-trustee, and we turned around and called Jim and said, we're in. We're going to support it. And they did a beautiful renovation there. And the Oscar J. Tolmas Veterans Pavilion, I'm glad to see you got that new kitchen, Chief. I've seen the old kitchen. I didn't see the new kitchen. But no, it's very nice. And, my co-trustee and I are just very lucky that we're able to help people in the New Orleans area. Speaking of that, and veterans causes, I made a list of the causes that we donate to. And you all know veterans, the Volunteers of America, the Veterans Center, and the Veterans Pavilion. We support an employment program for veterans through a charitable organization called Next Ops. And we support the Lieutenant Commander Oscar J. Tolmas Louisiana Employment Program. This organization's out of Texas, but they have a New Orleans location, and we only support the employment for the veterans in Louisiana. And why? That's where Oscar Tolmas made all his money, in Louisiana. So that's why we try to keep all of our money local. We support a Veterans Daily program along with transportation of veterans to the Kingsley House facility. We support the Veterans Equine Therapy program for veterans with PTSD issues through New Heights Therapy Center, which is on the North Shore. We provided 3 service dogs to veterans, and we're working with Patriot Paws Service Dogs and Warrior Canine Connections to provide additional dogs. And Volunteers of America, John's helping us with that, John Sellers. And last but not least, we provide college scholarships to children and grandchildren of veterans through the Kelly Gibson Foundation. I have no knowledge of government regulations, rules, dealing with veterans. The only thing we knew is they needed help. And so that's why we did it. Thank you very much for allowing me to do this, Jim.
Thanks so much, Vince. And again, thank you for your constant support. I want to remind everyone as we continue to move along, if you have any questions, please do put those into the chat. And we will take those once we hear from Danielle Evans, who is up next. Danielle Evans serves as the North Shore Field Representative for Congressman Steve Scalise in Louisiana Congressional District 1. She's worked in this position for 13 years, where she handles many different constituent issues, including veterans and military affairs. She's the daughter of an Army veteran and takes great pride in serving the veterans of our community. Danielle Evans, I turn it over to you.
Good morning, everyone. Thank you for inviting Congressman Scalise's office to take part in this panel. Like you said, my name is Danielle, and I am the North Shore Field Rep for Congressman Scalise, and I have been for the past 13 years. I'm based out of the Mandeville office. I've actually had the pleasure of meeting Jim before, and we've done some projects with VOA. I've seen those beautiful houses that are in Covington, the cottages. They are gorgeous, and you guys are doing a great job. I handle constituent issues in casework on a daily basis. My biggest issue that I deal with is veterans affairs and military issues. I talk to veterans on a daily basis from our area. You know what kind of issues they're facing. We deal with VA disability, pension matters, homelessness, all kinds of things them and their families are calling in on and seeing how we can help. It's very personal to me, helping veterans. I'm an Army brat, so hooah. And I'm proud to be able to help them on a daily basis because my father served in the Army for 23 years. So it's important to me. My coworker in DC, Mitchell Shea, he handles the legislation side. And we kind of work together, hitting the VA from both sides as much as we can on these issues. Congressman Scalise is very supportive of our veterans in this area. They've been working on legislation with the rest of Congress lately, trying to get as much compensation and funds down here, especially for our veterans. And I know you guys know a lot about those programs. And I heard Mr. Rooks mention the CARES Act and how there was some funding in there. So I'm glad that was helpful. But I'm honored to be on this call. And if you guys have questions for me, let me know. Like I said, I kind of do more of the local issues, but I'm welcome to take your questions when we get to that point. So thank you so much.
Great, thank you, Danielle, and thank you to Congressman Scalise for his support of veterans throughout our region and for your support of Volunteers of America. So we're going to turn it over to questions now and make this a discussion. I don't see any questions in the chat so far, but I do have a few of my own. So I'm going to start with those, and if that gets the juices flowing for everyone else, please feel free to just drop those questions into the chat. Gerald, I'm going to start with you. This has been an unprecedented year with a number of challenges. Can you talk a little bit about how your program has been impacted by COVID-19 and the economic challenges that this year has brought?
One, as you stated earlier, I have two programs. I have a Veteran Transition Housing Program and our HVRP program. I'm speaking about the HVRP program, which is our job placement program. That program is it's being impacted because there's so many people lost a job during COVID, and now some jobs are coming back. But what we're seeing, I said earlier, was underemployed. We're seeing a lot of people who are qualified for higher-end jobs accepting jobs that they would normally accept. And those jobs might be in the restaurant industry, security, those type of jobs that we would normally be able to find for homeless veterans. We're struggling finding those jobs because when we reach out to employees, they say they're hiring people who are overqualified, but they're looking for income. So that's an area we're struggling in New Orleans and in Homer. But this is just not a local issue. It's across the nation. I was on a call yesterday with other affiliates from Volunteers of America, and everybody's voicing the same concern with the ACRP program, and the Department of Labor has acknowledged this, and they're trying to come up with best practices, but it's a struggle right now to find jobs for our homeless veterans. As far as our transition housing program, well, once again, this is a struggle across the nation as far as occupancy rate. Most GPD programs are seeing anywhere between 50% occupancy or less. And because of the CARES Act, a lot of funds are going toward the supported service for veterans' families, and a lot of veterans are being put up in hotels, which impacts transition housing. So I don't have an answer to those challenges, but it's a challenge across the nation.
Gerald, one question I just got through the chat. It says, do you see a certain age range for veterans needing housing assistance over the past several years?
I wouldn't say a certain age. What I would say is we're seeing more and more younger veterans coming to our transition housing before the pandemic, and which was kind of concerning to us to see a 21-year-old homeless veteran, because normally it takes years for a veteran to become homeless, not in their early 20s. As I stated earlier about support networks, normally when you're discharged, you have your families, you have friends, you have relationships that you can rely on. And it takes time for veterans to destroy those relationships. But now we're seeing veterans who are suffering from PTSD coming into our facility at extremely young ages, like I say 21. And you think about it, most veterans sign up for 4 years. So that's probably a veteran who signed up at 17, did his time, in less than a year after being discharged, he's homeless. We don't see veterans in the 70s and anymore. So it's between 20, 25 to, I'm gonna say 60, we might see that range.
Got it. One other question just came through the chat, again for you, Gerald. What does the partnership between Volunteers of America and the local VA look like? That was the question that came.
Great relationship. It is an outstanding relationship. When I took this job, I'm gonna say 10 years ago, I heard all the horror stories. I haven't experienced any of that. I could pick up the phone at any time and call the case manager at the VA, and they would be at our building in 15 minutes with assistance. We have a beautiful relationship with the local VA.
All right, Gerald, I'm going to give you a break and turn a question over to Vince. Vince, you named a number of different projects that you all have supported. Could you talk a little bit about what makes Volunteers of America's services so unique and so important? You touched on it a bit, but could you say a little bit more about what in particular draws you all to Volunteers of America?
Well, I think because Volunteers of America has so many different programs that are run so well, and we've not always donated all of our donations to the Veterans Program. We've donated to the mentoring program, we've donated to the supported services program, we donated for a match for some renovations on a couple of buildings that you guys own. I like Volunteers of America because I can get on the phone and call Jim, Boris, or John and say, look, we're looking into doing this, and they're able to assist us because they either have a program or they know someone that has one. And they're very efficient. And that's, Lisa and I are both CPAs, and we look for efficiently run organizations. We look at financial statements. We know the people. We meet, I met Christy, I know Fred Myers, I know Jim, I know Boris, and so we get involved with our organizations. And that's why we picked Volunteers of America back in 2015, because we knew that they were well run. We saw the face of Volunteers of America, Jim LeBlanc, and now he's transitioning that face to Boris. But, that's why we support them.
To be a much better face, Vince,
But can I add one thing, Nick? I wanted to share an experience that I had with a veteran. Gerald talked about PTSD. And you guys, that, as I said, we provided some service dogs for some veterans, and we're looking to do it again. Well, whenever we provide that dog, I and/or Lisa will visit with that veteran when they present the dog to the veteran, officially present it to them. And there was a lady, a young person, Gerald. She was, 30 years old. And I met her on the West Bank and with the trainer. And she was very, very timid. And her psychiatrist was there from the VA. And she told me right away, she said, look, when you get close to her, she might back away from you because she's going to feel very nervous around you. So before we took a picture with the dog, the psychiatrist told her, Mr. Giardina's here. He's not going to bother you. He just wants to take a picture with you, with the dog. And when I stood next to her for the first time, she backed away. And so, we had to position like the psychiatrist between her and I. And so she didn't want me to stand next to her. She was that nervous. So that's my only experience with PTSD, but it's severe. It can be severe. Thanks for letting me share that, Nick.
Yeah, thanks for sharing that, Vince. And that's a good segue to a question for you, Gerald. How do y'all really look at the whole person that comes through your facilities in terms of those mental health challenges, behavioral health challenges, all the different things that are needed to support someone in getting their life into a place where they can be independent? How do you look at that through your program, Gerald?
That's a great question. One of the first things we do is we have a round table with the VA before the veteran even comes to our program. So the VA, we identify some of the needs of the veteran. Is it substance abuse or mental health? So we know in advance if that veteran is suffering from that. So once they get there, we ensure that they have the proper medication that the VA has prescribed to them, and we monitor the prescription that the veteran is taking their prescription the way the doctor wants them to. But we also make sure that the veteran is seeking treatment and attending the treatment at the VA hospital, because a lot of times they don't want to go to the appointments. So we make sure they know when their appointments are and they get to their appointments. And if they don't go, the VA will reach out to us and let us know, hey, Gerald is short for his appointment. But we also, you'll be amazed that the veterans within the facility, they understand PTSD. I suffer from PTSD. I think most veterans, combat veterans, suffer from PTSD. So the compassion that you will see just within the community of other veterans looking out for each veteran. I've had veterans come to me and say, hey, so-and-so is something, they're not on their meds. Something's wrong, something's going on. So it is 100% a community within the buildings, and everyone understands that PTSD is real, mental health is real, and we basically look out for each other.
Thanks, Gerald. Now I'm going to give, I think this will be our last question, and turn it over to Danielle. Danielle, you see this issue from kind of the high level, seeing a lot of the different pieces of the system work together. Are there lessons that can be learned from the efforts that New Orleans has taken to get to functional zero? And then this is going to be a two-part question. What do you see as coming down the line in terms of next steps for supporting veterans as far as the federal government is concerned? Gerald mentioned the CARES Act. We know that there were some provisions in the HEROES Act that really supported veterans. What do you see as those next steps?
I mean, first of all, you guys are doing an amazing job in New Orleans with the homeless veterans issue. And we're not seeing that everywhere across the country. So that's great to hear that here locally, we are leading the way. That's good to hear for Louisiana. So I think continuing on the path that you're on, COVID kind of threw a wrench into everything, of course. And like Gerald was talking about, I know with the jobs and things like that, that has been a challenge for veterans and for other situations as well. So that this year in general has kind of went out the window, I think. But as far as getting back on track, what you guys are doing is great. Federally, just continue to have the funding coming to the organizations that need it, that spend it wisely. The partnerships with the VA. I've been working here for 13 years and I'm still constantly trying to make sure I have good communication and partnerships with different aspects of the VA, because I work with all the different offices across the country on different issues. As far as legislation goes, the congressman recently, the House passed some bills that became law this year. They passed the Veterans Compensation Cost of Living Adjustment Act, which provided a cost of living adjustment for disability compensation. So hopefully that's going to help out with some families. And then also the Commander John Scott Hannon Veterans Mental Health Care Improvement Act. I know that's a mouthful, but that makes a number of improvements and enhancements to the VA's suicide prevention program and increases VA mental health workforce, which is huge because we know that we're seeing, unfortunately those numbers go up, and I believe it's approximately 20 service members and veterans who die by suicide each day, which that needs to be zero. So those are big major legislations that have already went through. The National Defense Authorization Act is currently being worked on. They're hoping to pass that final package before the end of the year. And that will definitely include funding for DOD and for the Veterans Affairs Administration, which will trickle down to our area and assist veterans here. So those are kind of the big things that are being worked on right now as far as Washington goes and in Congress. But here, I'm just continuing to work with veterans on a daily basis, getting the calls that come in, all the way from when there's a funeral that needs to be done, and we have 24 hours to get the information and get that handled, to a veteran that's trying to get disability, or someone that's been working through the system for years, and unfortunately it does take years. So anything we can do for those veterans, the widows, the children, any of the family members, to speed up the process a little bit is kind of what my focus is.
Great. Thank you so much for that, Danielle. And thank you again for participating in this panel, in this community forum. Thanks to you, Vince, again for participating and for your constant support. And thank you all for joining us for this community forum. That concludes our time together. I really appreciate everyone's involvement and hope that you'll stay involved. To learn more about Volunteers of America, you can go to www.voasela.org. Thank you so much, and happy Veterans Day, everyone.
Thank you all. Appreciate it. Thank you, Nick.
Thank you.
Thank you.
Big fan.